The ACE loudness scaling test consists of a typical loudness growth assessment. It is an identification task to assess the intensity coding of sound. Narrowband noises of 250, 1000, or 4000 Hz are presented at different intensities. This is graphically represented on the horizontal axis, going from 10 to 100 dBHL. The listener should scale the perceived loudness, on a scale ranging from 0 to 6, corresponding to inaudible, very soft, soft, normal, loud, very loud, and too loud. This is represented on the vertical axis. The individual listener does not receive the entire range from 10 to 100 decibels, but only the intensities between the lower and the upper fences, which are set during the training session. The graph also contains the median values in hearing listeners, as well as the 95% confidence interval between percentile 2.5 and percentile 97.5. This represents the normal zone. How to use and interpret the test results. This test is particularly useful in patients with hearing aids or cochlear implants. Since it is essentially a low-level identification task, this test requires some adaptation to the device. Therefore, this test should not be used at switch on. It is rather recommended to do this test after a couple of weeks or months of adaptation to the device. If test results fall beyond the limits of the normal zone, this indicates that sounds of these intensities are not well coded by the device. For instance, if scores fall in this area, sounds of 65 to 85 dB are perceived too loud. You may want to change the program of the device to cope with this. In cochlear implants, this may typically influence the settings of the C levels or M levels. Likewise, if scores fall in this area, sounds of 30 to 45 dB are perceived too soft. In cochlear implants, this may typically influence the settings of the T levels.